àwẹ̀ àti bó ṣe relate pẹ̀lú ìlera ara. Alhamdulillah Ọlọ́run fi wá ní Qur'an ní Suratul Baqarah ní pé a'udhu billahi minash shaitanir rajim ya ayyuhal ladhina amanu kutiba alaykumus siyam kama kutiba alal ladhina min qablikum la'allakum tattaqun. Ọlọ́run sọ fún wa pé òun ṣe àwẹ̀ òun prescribe àwẹ̀ fún wa gẹ́gẹ́ bí òun ṣe prescribe fáwọn ọjọ́ tó ṣíwájú ká lè wà nínú àwọn ká lè attain taqwa. Àdèmọ̀ kẹta bá lọ sí hospital tí dókítà bá kọ oògùn fún wa because dókítà mọ̀ jù wá lọ ń pa ara wa ló ṣe máa prescribe oògùn fún wa. So tí dókítà bá prescribe oògùn ó mọ̀ kó dáa fún wa ni so Ọlọ́run wá prescribe àwẹ̀ nísìnyí làwọn akànfẹ́ wa try àmọ́ kó dáa kọ̀tẹ́ tó prescribe ẹ̀ òun àtọ̀dọ̀ ẹ̀ gbogbo nǹkan ti wá. Alhamdulillah díẹ̀ tó ní káwa náà lè rorí pa ẹ̀ lénìí la fẹ́ try àti gbéyẹ̀wò látàrí bó ṣe relate sí àwẹ̀ but a mọ̀ already pé ó ní benefit ní Ọlọ́run ọba láyé lọ́run fi sọ pé ká ṣe. Now nísìnyí àwa fẹ́ wo kí ni science náà sọ nísìnyí nípa ọ̀rọ̀ àwẹ̀. Àwẹ̀ basically ni pé kéèyàn má jẹun for a number of hours. Èèyàn máa jẹun nísìnyí èèyàn ní jẹun for some time èèyàn máa jẹun later bá ṣe máa ń gbà. Àwẹ̀ is something tẹ́ ń pé before kí Islam tó dé náà ni àwọn ọjọ́ tó wà níwájú wa ti ń gbà wọ́n lọ ṣe sọ́nù Quran. Evidence náà show pé Hippocrates for example ó sọ̀rọ̀ nípa àwẹ̀ òun tiẹ̀ rò ó pé àwẹ̀ ní benefit tó ń ṣe lára bọ̀ kó of course scientific methods sì wà develop bíi tèmi nígbà yẹn so information yẹn ò jinú but Hippocrates ti tọ́ka wá sí tẹ́lẹ̀. Now àwẹ̀ tá a máa ń gbà ní Islam alhamdulillah Ọlọ́run sọ Ramadan fún wa tọ́lọ́ ní ashahru Ramadan alladhi unzila fihi al-Qur'an. Àwẹ̀ oṣù Ramadan ni Ọlọ́run sọ al-Qur'an kalẹ̀. Ẹni tó bá tí oṣù yẹn bá bá láyé falyasum kó gbààwẹ̀. Ọlọ́run sọ̀rọ̀ onírìn àjò àwọn tó bá rẹ̀ and all that. Nǹkan tá a fẹ́ lò gangan ni pé that process medicine nísìn àti wọ́n employ ẹ̀ àti wọ́n múlò nípa bá ṣe ń ṣá àti promote ìlera nínú àwọn patient wa cause a mọ̀ pé oúnjẹ àwọn olóyìnbó ní you are what you eat so oúnjẹ nísìn ti wà ní center ọ̀rọ̀ ìlera in terms of pé a ti rí pé gbogbo àwọn non-communicable diseases that's àwọn àìsàn tí ò kí ń ràn láti person to person a ti rí nísìn wípé àwọn àìsàn yìí oúnjẹ ni main issue tó wà ń bẹ̀ of course sedentary lifestyle smoking alcohol náà wà ń bẹ̀ but oúnjẹ wà ní center issues yìí so scientists nísìn tí wọ́n á wọ́n pé okay wọ́n dà pé oúnjẹ tá a bá lè control irú nǹkan tá à ń jẹ tá a bá lè control ìgbà tá à ń jẹ tá a bá lè control bá a ṣe ń jẹ it has a lot of impact on our health. Àwa fẹ́ wo even èyí tó fi lágbára jù nísìn tá à ń deal pẹ̀lú ọ̀rọ̀ cancer. Cancer is something tẹ́ pé nǹkan burúkú tó ń pè ní cancer cells tó máa ń grow lára tó máa ń proliferate independently of the body's control. Now nísìn àwa fẹ́ wò pé kí ni impact sí fasting gan lè ní lórí irú nǹkan tó ń dà wá láàmú tó báyìí because cancer àmọ́ kan tó ń fà for most of them àdẹ̀mọ́ nǹkan tá lè ṣe ń pa ẹ̀ mostly ìyẹn náà máa rí pé púpọ̀ ní ọjọ́ bá ní cancer ikú náà ló máa ń fẹ́ gbẹ̀yìn ẹ̀ years down the line. Now so ọlọ́ọ̀bá láyé náà kó ràn wá lọ́wọ́ lórí bá ṣe máa borí cancer but for now a fẹ́ wo kí nípa tí fasting àwẹ̀ tó ní lórí cancers. Cancer ń pa àwọn èèyàn tó pọ̀ in 2020 for example wọ́n ní èèyàn 19.3 million ló ní cancer and more than 10 million of them ló kú. ẹ ti ní pé that's a sizable number among àwọn tí wọ́n ní. Okay, so tá a bá ń jẹun a máa increase levels of glucose tó wà lára wa levels of lipid levels of protein all this ló wà important fún because cancer growth lẹ́ni tí ká bá dẹ̀ fẹ́ grow ó need the raw material so raw material náà làwọn oúnjẹ táwọn ń jẹ so àwọn scientists wá rí pé tá a bá lè control oúnjẹ tá à ń jẹ tá a bá lè reduce oúnjẹ tá à ń jẹ ó likely pé cancers will also starve good enough àwọn normal cells tó wà lára wa àwọn ní ability àti convert the source of energy wọn from glucose, lipids and all that to ketones. Ketones is usually the body's last resort when it comes to energy consumption, right? So, but our normal cells utilize ketones as source of energy, but cancer cells lack the ability, alhamdulillah. So tabati fast, if the body gets into a ketogenic state, that way cancer cells are going to have to starve as well. The main thing is that cancers, because they are growing very fast, although independent of the body, but they need the body's raw materials. So we will remove the raw materials from the body. That's one way that scientists are now knowing that listen, fasting ni wulo in terms of cancer prevention and management. American Society of Cancer, most of whom are in 2023, they pay more than 42% of the new cases not recorded in 2023 were due to preventable causes, like dietary causes, like alcohol, like smoking, lifestyle issues, but diet stands out among the reasons, whether in sport, in low economic setting or high socioeconomic setting, the problem cuts across. In fact, I told you high socioeconomic status gone, they are the ones that are even more affected because their food is even in abundance, and issues of obesity and being overweight is preponderant among that aspect of society. You see, different fasting protocols and dietary protocols not to develop, right, that is designed to starve the body. Because when you starve the body, the normal cells will be fine. Cancer cells, loma jaya. Lashiman shebe. So among penny intermittent fasting, among lomi, amani time restricted eating. Right, which is basically Timba describe cotton son science and Muslims then bomb you would realize that Gele Bashin Shin Islam no one wants sort of Babu Kotada, sorry, also for Sallallahu Salam, Bon Biarim Salam. Why Petitano Mangba and John Monday, Amon Salam, Mangba and John Monday, John Thursday, I don't be me different reasons. Enjoy not be me, enjoy any wahi day. Thursday, your ambitions lost okay. Mo dem fẹ́ kí wọ́n pé kí n wà ní position tẹ́ ń pé like wàá nà sọ him kí n jẹ́ tó ń báwẹ̀ nígbà tí wọ́n bá ń gbé this lọ sókè, right? But this in the science àwa tí wàá mọ̀ pé Monday and Thursday èèyàn kan kọ journal kan, you can go to PubMed, you can go to NCBI, àwọn kan kọ journal kan, àwọn sọ pé ká mú bí ọjọ́ méjì lọ́sẹ̀ ó dá to preserve our health in terms of fasting. Ó wá ń sọ pé weekend. Avoid weekend, because for weekend you want to be with the family, you can maybe grill steak and do other things, right? But so leave out the weekend. You can start on Monday, right? You fast on Monday, right? Give some space after Monday as well. Then fast on Thursday. I think but scientific study, meanwhile, alhamdulillah, is something enshrined in the sunnah of our beloved sallallahu alayhi wa ala alihi wa sallam. Ọ̀rọ̀ 13, 14, 15. Nísìnyí wọ́n ti sọ, evidence has shown. Ìgbà téèyàn bá mú few days lóṣù, téèyàn fi ń gba àwẹ̀, ó dá fara. Ọ̀ṣunla àmọ̀ kí ọ̀ṣunla máa gbàwẹ̀ ọjọ́ mẹ́ta, 13, 14, 15, sometimes numerous of that. But it wà repetitive. 13, 14, 15 of every month, Nanabi Mangbawe. Nísìn, intermittent fasting dictates that Kagbawe more, at least a number of days, let's say, okay, to be able to preserve health, right? I'm aware Dawood no, Tanabi Sallam Sonpe, Dawood Mangbawe 1 day on, 1 day off. Now, so I did be 6 months in a year. All this, alhamdulillah, we now know we medical benefits, right? So evidence has now shown that fasting, right, can help not only prevent but also treat cancers. What happens is it boosts the efficacy of chemotherapeutic medications and also the body's tolerance to these medications when patients undergo fasting or starve their body prior or during the treatment, right? Abu Hurairah also sallam pé Ànábì ọ̀rẹ́ òun àtàtà ó sọ fún òun pé ó advice òun pa nǹkan mẹ́ta kan pé òun náà òun ní yé má ṣe tóun máa fi kúrò láyé, which is fasting ọjọ́ mẹ́ta nínú oṣù, kéèyàn máa yan nọ́fìlà dùà àti kéèyàn máa sùn kéèyàn máa ti kí wítìrì tán. Now hadith yìí wà nínú Bukhari àti Muslim. So medically náà alhamdulillah àwọn olóyìnbó sọ pé ká gbààwẹ̀ on alternate days, short term intermittent fasting for 8 to 12 hours a day, or sometimes prolonged intermittent fasting, maybe the whole day, or with a particular frequency per week. Tá a máa ń ṣe Monday and Thursday, right? At least 1 to 2 days per week of total fasting, or meeting up to 25% of reduced daily caloric intake, right? These are common variations of intermittent fasting, and they are helpful to alleviate various diseases like obesity, diabetes, neurodegenerative diseases, and also ultimately cancers. Because taban jẹun less, insulin-like growth factor, the levels decrease, and we know that this is a very, very important aspect of cancer development in the body. Tó bá ti wálẹ̀, it boosts normal cell defense, enhances the autophagy lára, and apoptosis, which is programmed cell death. Gbogbo eléyìí ni ó dáa fún ara. There's a housekeeping mechanism tára máa ń lò àti fi máa sure pé a bad cells being produced in the body. This is only possible when, like, that mechanism is sharper when we are fasting. Our cancer patients, wọ́n máa ń jọ bí pé wọn ò lókun, wọn ò ní mi nínú or something, because wọ́n máa ti lose weight, looking emaciated and all that. But fasting has even been shown, even in those patients, to be very, very helpful, very, very helpful in helping remittance, in helping them cope with chemotherapy medications, and also for overall optimized outcome.